Good afternoon, everyone. I am Khush. I'm a registered physiotherapist here in BC. And I am really glad to talk with you about fall prevention for Parkinson's disease. And I understand how unique challenges and experiences are for somebody who has had a diagnosis of Parkinson or a caregiver who might be supporting somebody who has Parkinson's. Thank you, all of you, for joining here us today. Um, so today we are going to talk about some of the risk factors. So why somebody with Parkinson's might be at increased risk of falling and what your personal risk factors could look like. What are some strategies we can use to prevent falls and remain independent? Some simple evidence-based approaches that you could take home with you after finishing this webinar, as well as some tools, some sort of home safety modifications you could implement today. We are familiar with the falls in Parkinson's patient. To share some statistics, we know that about 60% of people who have Parkinson's, they fall annually. And out of that, there is a higher risk of injury, about 2 to 3 times of a recurring fall if you have had fallen once. And the good news over is that those who go through a comprehensive treatment program, there are lots of evidence-based treatment programs available, and those who are able to go through with it decreases the chances of falling by almost 30 to 40%. So it's very much predictable and preventable. So why does falls happen in Parkinson's disease? When we talk about Parkinson, we could talk about either your primary Parkinson's, your secondary Parkinson's, the various Parkinson plus conditions. All of those can be categorized all under one umbrella for current purposes. Um, with the Parkinson's disease, it's a neurodegenerative disease, which means there is a lack of dopamine in the neurons, and there is also a formation of some form of misfolded proteins that develop within the brain. As a result of this, the as a result of this process, the connection that is happening between the brain and the body is not working very well. Think of it like your cell phone having a poor connection. When it's not communicating very well, the information is not transmitting clearly from brain to your body. Now, because of this communication deficit, there are some form of movement challenges which builds up. And this leads to some form of motor and sensory disconnect that is happening in the body. So because of this, some people find difficulty in maintaining their balance. They find that when they are starting the movement, when they start the movement, it's harder to get going. They might be trembling in one place for a longer duration. It might be harder to stop the movement. It might be difficult to plan the movements. As a result of this, they also feel the feeling of their feet getting stuck to the floor or glued to the floor, which is similar to freezing. And it's a very frustrating sensation for somebody who is going through with this. Also, once they start walking, their steps are a bit more smaller and they are shuffling when they are walking. And there is also a reaction time that is a bit slower, especially when they are walking backwards, when they are turning. All of those can lead to difficulty in judging their movements. So why does this movement challenges happen? So because of this motor and sensory disconnect, we have an internal feedback system in our body. Because of the disconnect, this internal system is not working very well. So they find difficulty in judging how big of a step to how big of a step to take, how fast to go, how they are moving, whether they are speaking loudly or not. The good news here is that despite having these movement challenges, it's crucial to understand about it so that you can take some steps to work towards it and remain active and independent. Next is about some of the cognitive challenges. So, along with the movement challenges, there are some difficulty in how you are implementing your thinking skills. So, they may have difficulty doing two things at the same time. So, think of walking and talking at the same time, or walking and taking out phone from your pocket, or carrying a grocery bag as you are walking. Other is reduced attention and focus, and the attention can be scattered. It's harder to shift your focus and attention from one to another point. They may feel less sure about their movements. They are not sure if they're generating enough force, they are developing enough strength. And there is also some processing delays in decision making. Because of that motor sensory disconnect, their body is not giving them enough internal feedback to judge the movement. Same happens with the decision making. They have difficulty in judging whether the problem exists, what would be the solution for it, and whether they need to work around it or with it. So, understanding this, um, why falls happen in Parkinson's. If you or your family member can correlate with any of those physical risk factors, then it's a good idea to get some form of help about it. So, say for example, if you have had any recent falls or near falls or any close calls, or if you find you have a lot of hesitation before moving, fear of falling, which limiting your activities. So this could be either you're worried about any aspect of fear of falling, either within your home, whether you are outside, any form of fear. Next is the medication changes and avoiding any activities that you used to enjoy previously. There are also some environmental risk factors, and these are the risk factors that we find we have some impact over, because if we make some modifications to the environment, then it can make you safer within your home environment. So, poor lighting throughout the home, if there are any loose rugs and electrical cords, cluttered walkways, inappropriate footwear, and lack of grab bars and handrails. And we will go into details about how to modify your home as we go further into the slides. So, given the information about why Parkinson's leads to fall and what are some of the personal risk factors, we will next go into what can we do about this. So, we understood from before that if you participate in a comprehensive program, there is a chances that it decreases the risk of falling in somebody up to 30 to 40%, which is a pretty high number for fall prevention. And this comprehensive treatment could look like very much reviewing your medication with your physician, working on some mobility and transfers, making your home environment safe, and implementing some thinking and cognitive strategies towards it. So, there has been a lot of research out there which suggests that in Parkinson's, people who have Parkinson's, exercise helps to improve their quality of life in multiple ways. It improves their physical abilities, it improves their psychological abilities, their cognitive abilities, the way they do two things at the same time, their multitasking abilities. So, what does the research shows here? No matter the age and the stage, exercise is going to be helpful for a lot of people. If you know the starting early is simple crucial. So if you're early in your Parkinson's journey, then starting with an exercise program would be really helpful, and working hard. So you want to be able to have some form of high intensity exercises which can get you sweating, which can get your heart rate up, which can get you building up your strength and function. So this type of exercise could be aerobic activity. So anything that uses large muscles of your body to do an activity. For example, walking, running, swimming, cycling, tai chi, dancing, whatever you enjoy. Make sure you pick an activity that you think you would enjoy continuing with it. Next is a strength training. So 2 to 3 times a week of strength training using some weights, using higher repetition will build up your muscle strength and power, and it also will get your heart rate up. And balance training, agility training, and multitasking. So there has been a really good research study out there which suggests that if you participate in highly challenging balancing based activities, it decreases your risk of fall by 37%. So participating in balance activities and balance training is also crucial. So we understand that exercise is medicine, but how do we know that exercise is good for your body, but it's also good for your brain? And what happens actually when you're doing an exercise? So when we exercise, our brain, um, whatever dopamine that is left available in your brain for use, that dopamine is used more effectively when you exercise, and that dopamine stays in your brain for longer duration of time. It also, exercising also creates new pathways in your brain, and there is a development of a protein which is called as BDNF. And this protein is responsible to to increase your nerve cells, help them grow, help make new ones. So exercise works in a very powerful ways by providing neuroprotection. So whatever dopamine is available, it would utilize it more effectively, and neuronal plasticity. So it creates a new pathway around so that you can build more memory, build more muscle movement, build your reaction times. So think of it as if you are driving down Highway 1 and there is some form of construction happening, you would take a detour to go around to wherever you wanted to go. When you exercise, your brain picks up on this similar detour pathway and helps create a new ways to perform a movement and improve your function. So now that we know that exercise is important and it's one of the powerful tools you have to improve your function, you may question, I still fine, I want to exercise, I'm keen to exercise, I want to get moving, but it can be a bit frustrating when you find that your feet are feeling glued to the floor, or if you're finding that you're freezing quite a bit. So in those situations, we use something called as cues. And cues are basically, if you think of it, like little tricks that you can use to overcome your movement challenges. Think of it like the tool in your toolbox when you are feeling not confident with your movement. You can use these cues to get going. The one thing to note over here is that when you are picking up cues for yourself, it's important to work with one of the therapists. That way, they can actually help you figure out what cues are good for you and what is helping you overcome those movement challenges. And Once you identify those cues that work for you, you want to practice it and practice a lot. So there could be visual cues, which means you're using your vision to see, for using vision to see. So sometimes using a laser pointer can be an effective way. With the laser pointer, you can attach it to your walking aid and it can help guide where to take your next steps, looking ahead where you want to go and not down at your feet. This is simple, and focusing on targets ahead. This both is important, especially when you are going through a doorway or when you're going through an elevator and the elevator door opens and you are experiencing some form of freezing of your movement, freezing and not be able to take steps. This is where looking past it and further ahead to be able to take that step would be helpful. Next is having some form of colored tape on the floor and using contrasting colors on the steps. All of these colors and will give you as a guide on where to step when you are walking and where to step as you are going up and down the stairs. Next are going to be some auditory cues and cognitive cues. So auditory cues are something that you can use to hear or using your sense of hearing. So one of this is counting out loud. So it works, different cues work for different people, but it could be something, for example, 1, 2, or 1, 2, step, 1, 2, 3, go. Different auditory cues can work for different people. Using some form of a metronome for rhythm, marching to the music. Music is huge. Having some form of music and doing movements to the beats is really gets people going. Next are using your voice, making like big steps, saying big steps, and then using those voice and saying it out loud as you are doing those movements. Next are cognitive cues, which means you're using your thinking skills. So you want to first plan your movement. You are thinking of what you're going to do. Say, for example, if you are doing a sitting to standing up from your chair, stop and think what you are doing, and then you start the movement. Then doing one task at a time. So as we identify, sometimes it's difficult to do two things at the same time, like walking and talking or walking and carrying a grocery bag. So doing one task at a time might be helpful. Doing some mental rehearsals and breaking down big portion of a movement into smaller movements. Now, depending on the stage of the Parkinson you might be in, some of these strategies can help you improve your function. But at some point in time, if you find that you are having the ability to multitask, or if you are having the ability to do two things at one time, then according to principles of neuronal plasticity, you want to use what you have so you don't lose that function. And if you already have that function, use it and improve it. And that way you can have a lot more independence for a longer period of time. So the important key here is to finding the cues that would help you overcome those movement challenges and practicing, and practicing a lot so that it becomes very much a second nature for you. Next portion, these are some of the tools we would talk about home modification. So we would go through each room by room to talk about what modifications you can make in your home to make it safer. So first of all is the bathroom. Falls number one, bathrooms are number one reason where a lot of people fall, and a lot of falls happen in the bathroom. So installing some form of grab bars inside your tub, shower next to the toilet Using some form of shower seat or elevated toilet seats or a transfer bench might be helpful. Adding some form of non-slip rubber mats or strips in your bathtub, making sure there's enough lighting and everything that you need is within easy reach. Next are some of your living areas. So if you find that there are throw rugs or loose rugs that are not secure, see if you can remove them or tape it down using a double-sided tape. Make sure your all walkways are clear. If there is any clutter, let's make sure that your areas are free of clutter. There is a reacher or a grabber tool that you can use instead of bending over, because sometimes when you are bending over, there could be dizziness when you stand up from that position. So using a reacher might be helpful. Having enough lighting in the areas, whatever you need within the easy reach, and having your bed and your chair in a good height. If you need an armrest, make sure you have an armrest. If you need a back support, make sure you have a back support for that. Next are stairs. So installing some form of railing either on one or both sides could be helpful. Adding some bright tape on the edges of the steps, having a light at the top of the stair and the bottom of the stairs. And if you're using any sort of walking device, then make sure you use it appropriately. And if there is anything broken or uneven or loose, make sure to get it fixed. Also, especially around the stairs, it's important to not carry things up and down. Instead, you can use a basket or a bag to make it easier for you. Next is footwear and furniture. So if you have any worn out shoes, replace them. Get something with closed toes and arranging furniture so you can move around your home easily. And then moving inside your home. So if you have any pets in your home, dogs, cats, they are lovely furry friends to have around, but make sure you have some form of a collar and a bell so that you know when they are near you, so you can hear them. If you find you get dizzy normally when you are standing up from sitting position, in that case, you could move your ankles up and down for 15 to 30 seconds. This would increase circulation, and then you can stand up slowly. Next, outside your home, ensure all the parts are free of clutter, anything that's cracked or loose, to hire some form of professional help to get it fixed. If you are into gardening, there are lots of long-handled tools available these days. So using one of those would be helpful. And if you like to do any sort of house projects, again, same idea. Instead of using ladder, you are using some form of long-handled tools or having a caregiver close to you while you are completing your project. So some safety wins here that you can implement today are making sure you have enough lighting. So there are night lights available that are motion sensors. So especially if you notice yourself waking up frequently in the middle of night or having some form of sleep disturbance and you need to move out of your bedroom and go to a living room, having some of these night lights in different parts of your home would be helpful. Making sure that all the clutter is clear of the walkways and obstacles, having a proper shoe when you are getting up and moving around, keeping your phone within easy reach at all times for emergencies, and having your medication, organizing those pills, and taking them during the consistent time. So some of the daily living routines to establish are planning your movement. So having a bit of a idea of what you are doing next would be helpful, and you would be able to perform those movements much more easily. Understanding your energy levels. If you are too tired, maybe take an extra break before you start moving. Recognizing your levels of fatigue, your hydration, your nutrition, timing of your medication, when you are staying active, your healthcare team, which might include neurologist, your nurse practitioner, your physiotherapist, occupational therapist, speech therapist, social services, dietitian. Make sure you have enough support around you, and seek those support whenever you need some assistance. So we cannot complete this discussion without talking about medications. Um, a lot of people who might be in early stages of disease process might have some form of medication to help overcome their symptoms. These medications have on time and off time. So if your medication is working well, you're probably moving better. If your medication is wearing off, you're probably feeling more stiffness or some form of dystonia or different sort of movements. So try to see if you can plan your activities when it's an on time, and be extra cautious during off times. And in terms of medications, same idea. If you need to run any errands, go to bank, complete some of the house projects, do any physical activities, try to do those during on time of the medication. Keeping a diary is super helpful, especially if there is any changes in the dosage of your medications. So, key takeaways from today's discussion: falls are preventable. You have a lot more control than you think. Exercise is crucial. We know that exercising has its powerful way to improve your brain and body function. Your environment matters. So keeping your environment safe and free of clutters can ensure that it's not causing any hazard. Planning your movements, getting help when you need to, and staying positive. So even if you start doing some of the small steps, it can lead to a big change in how you are moving and how you are feeling. And all of this doesn't need to be done at the same time. Just pick one change you would like to do today, and then slowly build it up from there. I have some resources listed here if you would like to go through some home safety checklist. These are available through Health BC website. There are also some handouts on sitting, standing, and moving, which are basic exercises to get started with. No, just understand, if you are in the later stages of the Parkinson's and you might be sitting a lot, it is very, very possible to get that high intensity of strength training and workouts as well. So it's not just at there are different levels to it, and you can still get that benefits from exercise. And then there's a handout for physical activity guidelines for folks with Parkinson, and some of the exercises for people with Parkinson's through Parkinson's Foundation. Thank you so much. It was my pleasure talking with all of you today.
Thank you, Khush. And now I would like to invite Mike for our movement break.
There we go. Hi, everybody. So thank you for inviting me to give a little bit of a presentation on the benefits of martial arts. Just to give you a bit of details about myself quickly before we start is I'm 75 years old. I've been doing karate and Okinawan Kobudo, which is the study of traditional weapons, since 1968. I started in the UK, came here in 77. I hold an 8th degree black belt in karate and a 4th degree black belt in Kobudo. Some of you may understand that, the ranking system. I've been at it a long time. I was diagnosed with Parkinson's in September 2020, and it knocked me for six. I didn't quite know how to take it in because I've never had anything that's not going to leave me. Any broken bones or injuries you can fix, but the neurological condition was quite concerning to me. So for a while, I was quite depressed and took advice from my neurologist and also a good friend of ours that's a kinesiologist and physiotherapist, and found to my delight, of course, that one of the best things for Parkinson's disease is exercise. I've always trained nearly every day of my life and still do, so that's no problem for me. And as Khush said before, for some people, if you say exercise every day, if they've not done it before, that must be overwhelming. But to me, it came easy. Why did I start karate? Well, I was always a high level swimmer and played rugby, but there was something missing. And I went into a karate dojo or training hall one night in 1968, and I knew that I would do it for the rest of my life. The discipline and the camaraderie of the group was very impressive. So what do you get out of karate? Well, you get discipline, a disciplined lifestyle, you get camaraderie, you keep fit, you get self-control and self-defense. The problem is, for beginners, karate is often misunderstood. We have to dispel the movie myth. When somebody comes to the dojo, young or old even, older people are intimidated. Younger people all want to do flying kicks and all this exciting stuff, and want to enter tournaments and win medals. Well, that's just the tip of the iceberg with karate, traditional karate anyway. Competition is something you can do or you don't need to do it. So the expectations are quite unrealistic, as I said, and the study of karate, to some people's kind of put it, they get a bit disappointed because they wanted immediate skill to be imparted to them. It takes years and years and hours of study of basics, and we do lots of strengthening exercises. We do yoga exercises that are very similar to yoga, and a large component of our training involves balance and core strength, which is excellent for Parkinson's sufferers. It's how can I put this? The karate that you would learn for health and lifestyle would not involve competition. It would involve more of the study of an in-depth patterns, or kata as we call them. So you learn the basics one by one, and then you put two basics together, three basics together, with some punches, some kicks and blocks. For older people, we can keep the kicks lower. They don't need to be high kicks. You want stuff that maybe works in the street if you are, give yourself some confidence when you're out on your own. Once you've learned basics patterns or short combinations, you put those together in lengthy combinations, which we call kata. And the thing about this is that you're learning the moves, you're memorizing the moves, and then you're applying them to the physical level. So the combination of the mental and the physical is very important for Parkinson's sufferers. I tremor somewhat, but my students tell me that I don't tremor when I'm teaching and doing karate. And again, to reinforce what Khush said, I feel great after a workout. I feel invigorated, I feel refreshed, and my tremoring, if I do have any tremoring, tends to cease for some time afterwards. So the lingering dopamine that you were talking about, Khush, is obviously there. I find that my balance has improved immensely since I really I mean, I was doing karate every day. I wasn't really thinking about it. That's the point I'm making. Now with Parkinson's, I think about that element of balance and core strength, and it really, really works. Anybody that's interested, when I get older, I say people who are, say, mid-40s up might be intimidated to walk into a karate class. Pick your club, do some research and ask, do they have a section for senior people? You know, you don't want to just join in a kids class, for example, because it's intimidating. You can't do what they're doing. So they might use longer stances, but for senior people, use higher stances, wider stances. As I say, don't kick above the waist. You don't need to. The kobudo, which is the study of weapons, which is for example, the oak stick, which is 6 foot long. We use that. We use the sai, which are iron trident truncheons. We use spear and shield. We use metal knuckle dusters that were originally horse stirrups. That's how they came from. That's moving a lightweight, maybe 2 to 5 pounds. You're moving it through the space, and that's very good for bone density and, again, balance. And also, like with the empty hand kata, the weapons kata are very complex, so you're having to memorize them, study them, and apply them to the physical level. I can highly recommend, if anybody's interested, I can send details of recognized clubs in this area to Kelly, but wherever you are, see if there's an organization, for example, what we have is Karate BC, which is hundreds and hundreds of karate groups of all different styles. For example, I study Shotokan karate. There's Shito-ryu, there's Wado-ryu, there's Goju-ryu, there's Goju-kai, there's Kokushin-kai. There's all kinds of different styles, but they're all governed by Karate BC. That's a recognized governing body that vets instructors to make sure they have training in minor injury treatment, taping, instructional techniques. It's the Canadian Coaching Association that we have to take level 1, 2, and 3 in. So again, when you meet each week, you meet your friends. There's a social element to it. We have barbecues. We go away to seminars together. So I can't say enough about it. It's really improved my life with Parkinson's, 100%. If I couldn't do karate, I would do something else. The other thing I do is I play drums. I'm a drummer. I played drums since I was 5, and moving four individual limbs at once is also very good for Parkinson's, as the experts know. And after I go down and play drums for an hour in the basement, apart from driving my wife mad, it makes me feel great. I feel really charged. And again, if I'm tremoring a little bit when I start playing drums, it stops. So that's basically all I have to say. Very quick 5 minutes. It's hard to say in 5 minutes what I'd like to say, but I don't want to take anybody else's time up. I will answer questions at the end of the seminar if anybody wants to inquire in more detail. Okay.
Thank you very much, Mike. It sounds very fascinating how you found karate and how you do drumming and everything. So thank you for joining us. And it fits very well with our topic too, with falls prevention.
Exactly.
All right, I'll pass it over to you, Anja.
All right. Good. Can everyone see my screen?
Yeah.
Good. All right. So thank you, Khush and Mike. That was very informative, and I really love martial arts as well, Mike. So I really enjoyed your talk. And as you can see from Khush's presentation, we at Neuromotion are absolutely committed to providing our clients and their families with our clinicians' specialized expertise and our latest innovations to better the lives of individuals living with neurological conditions. Now, in terms of what I do at Neuromotion, I am the Neuromotion's Research Development Coordinator. And one of the research projects actually fit in nicely with today's webinar. And it's the Heel to Toe Otaga Falls Prevention Program. Now, with this research program, I basically want to see how we can better the Otaga Falls program, how we can make it more effective. And for this program, my hypothesis is basically that if we add this little walking device, which is the heel to toe device from Physiobiometrics, it gives auditory feedback each time you give a good step. So basically what I want to see is, does this auditory feedback during walking does it have an improved effect on preventing falls? Now, for this study, we are recruiting individuals of 55 and older who have maybe had falls in the past, or who are concerned about falls, or are considered fall risks. Basically, this program is a 14-week research program where you would do exercises, the Otaga exercises, 3 times a week. And do walking with a little ankle device every day. And these exercises and walking can be done from home. You would only have to come in at the beginning, the middle, and the end of the study, where we will basically assess your balance, your walking, and your fear of falling, and assess whether that has changed throughout the study. If you would be interested to participate in the study, or know of anyone who might be interested in participating in the study, you can definitely contact any of our clinics. We have 3 clinics, one in Vancouver, one in Surrey, and one on the island in Victoria. Then for those who aren't exactly sure whether or not they are at risk of falling, Neuromotion has also started implementing falls assessments that we give for free. So this is basically a 30-minute assessment where a physiotherapist or kinesiologist will assess your balance, your strength, your mobility, and other factors of that might indicate risks of falls. The assessment is recommended for anyone who is slightly concerned about their risk of falling. And you would walk away from this assessment knowing whether or not you are at risk of falling, and also with a toolkit of exercises that you can do that are individualized to your abilities, as well as the opportunity to join our foolproof program as well. Now, our foolproof program is a 12-month physiotherapy program where we tailor in the exercises to individuals who have been identified as fall risks. Your exercises will be based on the Otago Falls exercises, but it will be tailored to your abilities. And it's a 12-month program, so the initial assessments would be done via a home visit at your home. And after that, there would be monthly check-ins where the physio or clinician would come to your home, go through the exercises with you and see how you are doing. And by the end of the study, you would get a full analysis and report of your progress throughout the 12 months. Now, this is also quite applicable to today's talk. Neuromotion is pleased to host a NeuroFit BC training seminar where our physios and other healthcare workers will come together and receive training for treatments specifically towards individuals with Parkinson's disease. The course will be delivered by Naomi Casiro. She's a clinician and educator with extensive expertise in the field of Parkinson's disease. The purpose of this course will be to train our physios, other physiotherapists, and other healthcare workers how to treat physiotherapy safely. But for this, we will definitely need volunteers and applicable volunteers. So Neuromotion and NeuroFit BC are looking for individuals to volunteer if they have been diagnosed with Parkinson's disease. And if you can travel towards our Surrey clinic, that would be in a reliable and safe manner. You'd be more than welcome to join us. And if you can tolerate a few hours of activity and rest, we are mostly looking for individuals with Parkinson's disease that are either still walking independently or walking with a cane or a walker. Unfortunately, this program does not cater specifically for individuals who are wheelchair bound, for example, but hopefully there will be opportunities for such a course in the future. What will you do as a volunteer at this training day? Well, basically, the clinicians participating in this training will assess you and create specialized exercises for the individuals volunteering. You'd go through a bunch of exercises, and you'd have to be able to share some of your personal and medical history as well. So if you're comfortable sharing that, you're more than welcome to volunteer as well. After this session or this training day, you would be sent home with individualized exercises to treat your specific symptoms as well. And why would you volunteer? Well, it would be to learn new exercises and techniques specifically to treat your condition and symptoms. You could ask your questions to the instructor, who is an expert in the field of treating Parkinson's disease, and you can feel great about knowing that you have been part of training our healthcare workers how to effectively treat Parkinson's disease. If you are interested in joining this training program, please contact this individual right here. Her name's Anja Duminy. This is her email address and telephone number. You're more than welcome to contact her if you want to volunteer. And with that, I would like to thank everyone for having Khush and I, and on behalf of Neuromotion, we are very thankful to have presented for Parkinson's Society BC today. Thank you.